Hi, everyone. So the first findings I'm going to show you today is around the use of GetCheckedOnline provider-based testing among regular service users of GetCheckedOnline. So the findings were from based on the survey that we did in 2022. It is an online survey with GetCheckedOnline clients. So we invited them to answer the survey by email. So who participated in the survey? So we invited those who had 2 or more tests through GetCheckedOnline with a test done within the past 6 months period prior to the survey, and those who were 16 years old or older. So these people, we kind of define them as regular users of GetCheckedOnline here in this context. In the GetCheckedOnline account creation process, people were asked if they consented to be contacted for research or evaluation. So the invitations were only sent to these people who consented. So in total, we have around 4,600 people eligible based on the GetCheckedOnline program data, so those regular GetCheckedOnline users. In the end, we had 789 people included in the analysis. There was a drop-off because there were only about 1/3 of people consented to be contacted for research, and only about 1/3 of the people consented to do the survey. So to adjust for the non-response bias, we applied post-stratification weights to our analysis based on the age, gender identity, and number of GetCheckedOnline tests completed for the 4,600 people eligible. So the findings I'm going to show today will include weighted percentages. So first of all, we can see who are the regular users of GetCheckedOnline. So the majority of them lived in BC's Lower Mainland, and the median age was 33 years old. So this is quite a younger population compared to the BC population, where the median age was 42 years old. Here, we are also showing some socio-demographics of the GetCheckedOnline regular users. So we saw the majority of them were white. 11% of them had a gender identity that was not men or women only. 67% of them had a sexual identity other than heterosexual, and 12% of them identify as newcomers in the past 5 years. So compared to the BC populations, for example, 66% of BC population were not a visible minority, and 4% of the population are newcomers in the 5 years. So we can see GetCheckedOnline really kind of had a lot of, reach a lot of the people who are kind of on that minority groups. We also saw that GetCheckedOnline users included many people facing barriers to provider-based testing. So about 1/3 of them said they did not have a usual place they were comfortable going to get tested by a provider. About 1/3 of them did not have a family doctor or nurse practitioner. Over half of them said it was not easy to get tested by a provider, and 12% of them said they would not have gotten tested if GetCheckedOnline were not available. So now this chart shows us that many regular users have shifted to online testing. About half of the participants reported they only tested through GetCheckedOnline. About 1/3 of them said they mostly tested through GetCheckedOnline and sometimes through providers. Just about 15% of them said they equally tested through GetCheckedOnline and providers, or mostly through providers. So in the analysis, we look at the factors associated with use of GetCheckedOnline as opposed to the provider-based testing. So those outcomes that I showed you in the previous chart. And then we found that not having a family doctor or nurse practitioner and not having a usual place that they feel comfortable going to get tested are associated with greater use of a GetCheckedOnline as opposed to in-person or provider-based testing. So this shows that the availability of provider-based testing is one of the key factors contributing to use of GetCheckedOnline. On the other hand, getting tested regularly for STIs as part of their clinical care from a healthcare provider was associated with less use of GetCheckedOnline. So this shows people that they would go get tested through a provider as appropriate. We look at among people who go get tested for a healthcare provider and ask them, what's the reason you get tested through get care providers? So the most common reason is convenience. So over half of them, about half of them said they get tested because they are seeing healthcare provider for another reason. We also saw over a quarter of them reported they tested through provider as a result of their HIV PrEP. We also saw many people said they tested through provider because they had symptoms or their partner had STI. So this is a good sign, especially on GetCheckedOnline. When people report that they are having symptoms or their partners had STI, we recommend them to go see a healthcare provider for more appropriate care. So yeah, I think this is just kind of pointing that people are getting tested through provider as appropriate. So I think this is the last slide of the findings that I'm going to show you. So we also look at the socio-demographics associated with use of GetCheckedOnline. So we found that people younger than 20 years old with income less than 20,000 a year, with an education level of up to high school, and those who were born outside of Canada were associated with greater use of GetCheckedOnline. On the other hand, people with a sexual identity other than 2 as LGBTQ+, and people who were employed full-time were associated with less use of GetCheckedOnline. So just what does that all mean? So we saw greater use of GetCheckedOnline may be related to limited availability of provider-based testing, such as not having a family doctor or practitioner. So this suggests that GetCheckedOnline improves access to testing. We also saw GetCheckedOnline clients use provider-based testing when appropriate, such as when they had symptoms or when they are receiving care through provider for their HIV PrEP. So this means that GetCheckedOnline likely reduces demand on providers because people would use GetCheckedOnline for testing when they don't need to see a clear provider. GetCheckedOnline is also used for testing by some people commonly facing barriers to provider-based testing. So we saw like people with lower income, lower education, younger age, or with an immigrant status would be likely using GetCheckedOnline more as opposed to healthcare provider-based testing. This kind of also tells us that GetCheckedOnline improves health equity by reaching these people. With that, I am closing my presentation.